Jones?
Here.
Dr. Peterson? Peter Keith? Kathy Manuel? Dr. Isaac?
Here.
Dr. Henley? Dr. Vera White?
Here.
Dr. Hick?
Here.
Thank you very much. Thank you, everyone. And glad to see everybody is here safely. We were just talking about the weather that just came through, so.
No, we did not have anything here.
That's good.
I was getting calls from people and I was like, I don't know what you're talking about. We have no wind.
That's very
It's
good.
like, that's insane. It's like blowing our trees over. Like,
Yeah, Dr. Isaac Amos was on the road during the
I
time.
was on Curtis and it was like
Trees down.
ridiculous.
I know, I guess there are trees down all over the place, but it didn't even blow here,
That's good.
which is weird.
A limb from the tree between our house and our neighbors land on their roof, but
Oh.
it looked like it was okay. And coming here, there was one road closed because of a tree across the road, and another major limb. So
Last year during that major wind thing, I had a tree fall down right in front of my car in Prospect. I was, not the whole tree, but a whole big section of the tree. I freaked out. Scary.
That would be unnerving.
Yes.
Well, I'm glad everybody's here safely. Thank you all so much. And then I'm going to move to item C, approval of the agenda. So you have the agenda before you. Is there a motion to approve the agenda?
So moved.
Moved and seconded. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. And we do have a quorum with the 5 of us here, so 5. Approval of the minutes of the March 19th, 2024 meeting. So I'll entertain a motion to approve the minutes. Moved. Do I have a second? Moved and seconded. Any discussion, alterations or adjustments to the agenda, or to the minutes? Hearing none, all those in favor? Aye. Anyone opposed or any abstentions? Thank you. Public participation on agenda items. Do we have any public participation on agenda items? Please. Lisa. Go ahead.
Yeah, I am just here to answer any questions about our reports. We've started for our pediatric dental. We have started doing more like we just did Rantoul with a Head Start, do the dental exams. They also did sealants, so we're finally getting that up and running. Our team is working to do more of the rural schools. Sadly, we were on a roll with recruiting dentists and dental hygienists, and we have lost a lot, and which is it makes me sad because we're doing so well. We've lost a few recently. Right now, we still have 2 really good dentists. We have 2 public health hygienists, but we have decided we're not going to be able to open a facility at Kirby. We've had 2 leave, and then we had another one that we had signed that was going to start next month, and they had something that came up and they can't move from Peoria, which is a bummer, but I think it's just hard to recruit folks. We have really, it's nice in Illinois. It is easier than it is in a lot of other states for dentists on J1 visas and things to get licensed in Illinois. So we've done a lot, trying with a lot of J1 visa folks. Sometimes it turns out that they're maybe just not, for whatever reason, a cultural fit, especially with our working with our Medicaid population. But we are trying really hard. So we did submit a proposal for the regular to help with cost for the children's dental program, because at least about 30% of the kids at least, and I think the numbers now that we're going to do the schools again, the outreach stuff to the schools, the numbers should continue to go up with that, but that's what we've always said, that 30% of the kids served are usually from outside of Champaign-Urbana. And then if you have funding, since we're going to apparently be always recruiting, if you could support recruiting, again, we would really appreciate it. We've had some meetings with public health recently. It's a huge community issue, the access for uninsured Medicaid. As everyone knows, there's just fewer and fewer people willing to see them, which is very sad. It can be career limiting too for older folks. But hopefully it's really important. We're one of the few people for Medicaid and uninsured that provides a dental home, because it's one thing to go out and do the screenings and sealants and everything, but you also need to connect with people especially the kids, for a dental home. So hopefully our fortunes will turn, and we would like to open additional dental in Winter as well. Any questions?
In the last 3 years, so for the additional support of the 25K for recruiting, have those people, when they sign contracts, did they sign on to stay? Is it just a year to year that they sign on?
They signed
their
they are 2-year contracts. So unfortunately, Dr. Brito was really good, and she was with us for 2 years, and recently left. Her partner was completing like a forensic kind of dental program, so I think they moved to Chicago. But she did stay the 2 years, so that was good. I'm looking at my list here. We have Dr. Song, Dr. Coker, still, and then we have the 2 public health dental hygienists. Dr. Roy had signed, and now had a family emergency and can't leave Peoria. And then we had recruited Dr. Saad and Dr. El-Kendi. I think we're here like a few weeks, and it just turned out that they weren't a good fit for our population.
Thank you. I just when you had said that before, I was just, I thought others might be thinking the same thing, it was year to year, but 2 years, that makes sense.
Yeah, and we're hoping to build on the public health and dental hygienist program too. We've had some, it's been kind of a journey as far as the dentists, our dentists embracing that, but that seems to be picking up steam. So we're kind of excited about potential for that as well.
Well, I just could throw in something to add more of a problem, is we lost one of our longtime dentists.
You did
So,
too.
yeah, so we hired down to one dentist, and we have somebody hired that will work part-time, but that's it for a while. So that's a problem, because it's a huge problem. So we're getting lower and lower on dentists, in this community that will see Medicaid. I don't even know what to do about that. I don't think anything's going to be done about it unless it's eventually legislative, tied to taxes, something like that. Because I've been working on it for 30 years, and we don't have anything. So that's going to be a huge problem. Them down the dentist and us down the dentist.
The phone rings all day long. We get more calls, I think, for dental. Now they all kind of go to our call center, but we got about like 10 times the calls for dental that we do for medicals. So, and we're working on it. I feel like we're making progress. It's kind of a bummer that now we're down dentists again. But I do feel like our current leadership has the business acumen, with the Medicaid lower, very low compared to the reimbursement in most states is the same for whatever service, if it's behavioral, medical, and dental. But in Illinois, it's a lot less for dental and behavioral health. And I guess the good thing with like Medicaid dental is there's so much need, but it's a challenging population as far as no-shows and things. So we're trying to work on that, because in order, even a nonprofit or a public health, you can't do things that cost a lot of money for a long time, right? So you have to, especially as a community health center, you have a sliding fee, but it does also, all of the patients cannot be subsidized, but we're hoping to make operational improvements to be able to float dental better in the future. And if anyone has suggestions, let me know. it's just a heartbreaking need, it really truly is.
Well, Champaign, there are a lot more dentists than there were 20 years ago when I came up.
Oh, there's no shortage of dentists at all. The shortage is in people that will accept Medicaid or have sliding fees.
Well, that was an issue with Medicaid, and you cannot really, you have to have a special person just to file.
Oh, we're quite aware.
Yeah, so
Yeah,
a lot
right.
of us do shied away from that.
But you know what, that's a good, you know, now that you just said that, that may be something that we could look into like we did with the vision program. Is what was done with the vision program, because we had the exact same problem. And what we did here was we sort of case managed people in there and then did the paperwork. And then it got to be where they were like, oh, well, this isn't a big deal. And then they just took it all over, they took the vision project over, so we didn't have to do it. We only did it for maybe a year. So that's, if that's the issue, because trust me, I know, we have to have a whole infrastructure for dealing with the ridiculousness of the building. So, here we have it. So that is actually, that's an interesting.
What do you get, like a clearinghouse for the intake? And I want a dentist, or my child needs a
Yeah.
dentist, and then we field it out, we farm it out to the dentists who have said they'll take them, but they don't have to do the paperwork, it comes back to us.
Yeah, we just have to make sure that that's allowed to be done. It was with the vision program, we were able to do that. We called it the Vision Cooperative.
Do you-
But
did you
until
ask-
she just said that was one of the issues with Medicaid, because when we originally assessed this 15 years ago, that wasn't one of the things they were saying. They were saying they don't pay enough, or they don't, you know, the clients, if they take people with Medicaid, then their own clients won't come back to them,
Right.
which I don't think that's true. How would anybody even know?
Well, my husband and I had a dental practice in Texas. What we did was 1 day a week, all Medicaid kids coming in, and we do that. And he would spend a whole weekend just to make sure all the code is correct.
Yeah.
It's very meticulous. So he only limited himself 1 day a week for all the kids to come in and get that done. I never applied for the program because associate professor at the university, you know, I had the leeway of not doing that. But at the same time, it's just so much time consuming. It's not the dentistry that is hard. We can
Right.
do that. It is the paperwork that are issues. So for me to get involved in that is like, I do not have time to do that.
Right.
So what I'm hearing you say though is that if that's the major barrier and we have a template to follow to make it kind of a clearinghouse,
If it's allowed.
yeah.
I mean, we can have a meeting and all of us get together and look to see if that's something that we could do.
We have to look at like if the MCOs would pay us to process the billing of another provider,
Because,
basically.
Yeah.
because to be realistic, every damn time we come up with some kind of a workaround, then there's a new layer that they add on. Now we've got the MCOs to deal with, like Medicaid wasn't enough of a pain in the butt. Now we have the
Right.
medical, you know, what are they called? Medicaid, no, something.
Managed
terrible.
care.
Managed care, I'm like,
Do you feel like that would warm things up for
Oh,
the
yeah.
dentists in town and
Well,
that would
if-
create more access?
Is it possible, if I want to come in to do the Medicaid, I would like to be able to go in, do my dentistry and go home. I don't have to deal with the
oh,
other
now if
stuff.
somebody comes in here, that can be done, that we do know.
Yeah, what they're
If you
saying.
go into an agency, that can be done, correct?
What,
Like if we had dentists coming in here or to your place, they could do the dentistry and then the agency deal with the, like, you'd still have to be credentialed,
I
which is,
mean, yeah, the
Probably.
location would get around that
would be
paying for
around
it,
that.
and it would just be for, like you said, credentialing for Medicaid, which is really, really backed up. It takes a long time to get credentialed for Medicaid.
That's our problem with our new
And then,
dentists.
yeah.
what our issue, our big issue is And then the Medicaid population in general across any med service has a higher no-show rate and things. They just have things, they have more things going on, right? You're less likely to have a car. You might have to take 3 buses.
But we did get it down from what, Whitney? Whitney, we did that case management program with the dental, and what did that take our no-show down?
We're at 9.
9
I
from
don't
what?
think we can do what you guys do.
35.
Yeah, from 35%.
We're looking at, we are looking into that, but the no-show rate is killing us, because it's about up to 50%.
Yeah.
Yeah, but we did find out a workaround with that, and it's, we did, it got, what was that?
We're at 9 right now, and was it like a 35?
35
Yeah.
down to 9, so.
And you're not
and it does take a lot of time,
No,
but
we
it's
don't double
case
book.
managing them into it.
A lot of
And having-
reminders.
And you can't have the stuff that we have where it's like you get 3 times and then you're done. You can't do that because you're a FQHC, I get that.
Right, we don't turn patients away, we cannot turn patients away, but we have to do other things. And so we have enabling services to try to reach out to see if people need a transportation assistance.
I think we need to have a meeting with some other dentists in the community with this thought in mind that you brought up.
Well, because if it's,
We might as well
it
try.
becomes less, less expensive to try and hire or recruit new people, if we have the people who are willing to do it, if we could hire somebody that is, or fund a process that does all the backstage junk that the providers don't wanna do, and allows access where we have it already existing in the community, but we do the workaround, like you said,
Yeah.
but.
Because a private
Yes.
practice isn't, you're not gonna pay an intake person to do all of your
No.
billing for Medicaid, because that's basically what you would have to do. If you do it yourself or pay someone to do it, then.
Yeah.
In Delta, would Delta do it? I think that you could ask them too. In some states, they run those programs. But even then, they do not, those programs do not have a lot of huge participation with the private
Well,
dentists.
I wonder if you could get a grant to cover the personnel part, because did you see the first RFP to come out of IPPH in a long time last week?
Well,
Yeah.
no, what was it for?
I'll send it to you.
Okay. What was it?
It's rural health. It's a rural health.
Oh, the rural health, can we even count for that though?
No,
But the out parts of the county, so if you pull in the outskirts of the county, you can't use CU data, but you could pull like Broadlands and Sydney and Philo. You can pull data from, and I think it might be possible to apply for that grant.
well, the whole county is urban, so grants out of the Federal Office of Rural Policy. I'm pretty sure there's no
It classifies the whole county, not just by zip code.
because a big thing with the weights on that is the people that commute, and in particular, and there's such a huge percentage of people from the outlying towns and stuff that commute into the urban core.
And we also need sedation dentistry, big time
Yeah.
again, and that was a Carl Francis Nelson collaboration that you guys are gonna start up again?
Well, Jennifer's trying to get it going.
Yeah, because that's super needed.
But it might be good to have a community meeting to try, I mean,
I
it
think
never
so.
hurts to try it. And gosh darn it, who owns Delta Dental? I don't think it's bad to ask them, hey, you could get a grant, but I think they should pay for it.
Yeah, but I'm saying, this is something that's gonna come out this fall, and the funding's gonna come out this fall, and what we did is we just submitted one, and I understand where you're going on with the rural
They should
health
just pay
initiative and
for it,
stuff.
yeah.
But what we did is we did all of the outskirt counties and we did the borders. So Ford falls into it, Iroquois falls into it, Douglas falls into it.
Yep.
Whereas
Yep.
we don't, they all do.
Mhm.
And then we said, here are our border towns in the county, and that's how we turned it in.
So you picked out
We painted the whole thing, and so we painted the outskirts, that's what I was saying. If you look at the outskirts around, because it is for rural health, that's how we got around that and turned it in. So I'm just saying it might be a possibility, I don't know, I have to look at the IDP.
That's interesting.
RFP.
Okay, I like that idea,
But that is, you can do that, because they recognize that what you see in the city is not always, I work in the University of Illinois, and that's a big part of why we are urban, because we have such this tremendous influx of tax dollars, that come in from having the University of Illinois here. So, but when you get outside, Vermilion County,
I turned in their RWJF rankings as a part of that grant that we turned in, you know, just, again, yeah, I mean, showed the
Good old
outline.
Danville.
Yeah, it showed the outline of the counties, because there's, you know, there's crossover.
And Homestead, so we're just looking at the Health Resources and Services Administration just came out with, and I asked Julie and Rob about this, but they just came out with a new unmet needs score, and it has like all of these different things. It has like, I don't know, 12, 15 different criteria. But I'm shocked that the county, there is not high needs according to them. So I'm trying to,
That's always been something we have thought about, because we have no shortage of providers for anything, mental health, anything. We have no shortage of providers. We have a huge shortage of providers who will see Medicaid or have cited.
but there's transportation issues here, a lot of them, like home ownership is very low because of all the rentals and stuff. Maternal child health outcomes are bad, but then you always have to remember, like, you're comparing, like, to the deep south and stuff, you know, like Puerto Rico. So I don't know, but something just doesn't make sense about, and he thought it, I don't know, thought it had something to do with the zip codes and it being more sprawly. But I'm trying to figure out, because I don't like it, because I think there are some significant needs. And if you're trying to get person funding, if they think that you're low need, that's it makes it hard. But I like that that's cool, that you're able to get the.
Yeah, so we can look that, I wonder. Yeah, I'm gonna look at something else too, maybe I should first.
Anyway, getting back to the proposal, that we are just grateful for anything that you can support. And we are happy to be involved in any community level thing. We've had a couple of calls. I know they used to get like a lot of volunteer dentists and stuff, so we've sent out letters and things, and we haven't been able to get any takers. Maybe we're not asking the right folks.
Well, I think that the volunteer dentists, those have their own kind of issues that are problematic, but something like what you're talking about with where somebody comes in, even if they are technically a volunteer, but they're working under, you know, the facility and billing through the facility, and they still have a dental home, you know, that's a model that might be able to be tried.
Dental home is just a huge issue.
Yeah, medical home is too. I mean, the fact that we, you know, public health is providing services, we shouldn't be, because there's no shortage of any of these services. STD services, we don't need to really come here for that, or immunizations, unless it's an outbreak or something.
Can I ask a question? How many patient dentists are a day, or treat a day in public health?
With
11.
11. Okay. At what age to what age?
0 to 18. Here. We only see kids 0 to 18.
The dentists see that? Okay.
And then hygiene has 14, depending on what the needs are.
So from 0 to 18, if they need sedation, you have to kind of like cooperate with the call
Yeah.
anesthesiologist to do that.
And they open up their wait list or call center for that service like once every couple months.
We do nitros, but in the office, but that's it.
Yeah. But only Carl, or if you go to like Chicago or Indianapolis or outside of the county, you can get sedation dentistry.
Who's
if you
actually
need to put under.
providing the sedation?
Not sure.
Yeah.
Well, when we did it, it was in the hospital, right? So
Yeah,
it would have
they
been
went to the
they-
hospital for it. We were like,
Or
didn't we used to hook up with
maxillofacial
Francis
surgery,
Nelson for that?
Yeah, they would,
Yeah.
they would provide, somebody would provide the actual sedation and then the dentist would do what the dentist needed to do.
Right. But it was one of your dentists, or it was just a whole?
It wasn't our dentist,
So it
no.
was just a
It was
referral?
Francis
It was
Nelson.
ours, right,
Yeah,
and
so we did work
anesthesia,
together.
I think, did the.
Yeah, that's why I was asking, because, let me see what I can do. We have a whole sheet shift that my providers do that's, sedation is part of it.
Mhm.
And they have griped because some of them are not comfortable with sedations, even though we've given them training and education for it. So we have a smaller number of peds hospitalists that are now comfortable with sedations, but if they had a built-in method, a built-in way to learn and set up a patient population that really needs them for
It's really
sedation
needed.
service. Because we've been asked this a number of times by different people, oh, well, where can we do this? We're like, I don't know. But I think if we found the right stuff in the right space and the right personnel, that we could potentially have a win-win. So let me take that back to my operations people and ask them what would get in the way of that. And then I'll reach back out to you guys to see if we had set up a meeting or something.
Yeah, and we can do nitrous if we have a doctor that will do it.
That will do it, yeah.
Like, that, our other ones were not interested in doing it, therefore we didn't do it, but there's no barrier other than that.
Well, and truthfully, if you're doing sedation, pediatric sedation the right way, there should be a provider doing the sedation. There should be a provider doing the procedure. It should not be the same provider. And you can bill for both of those services.
Can't go
It's a
for
great-
nitrous, but somehow that's still important.
No, great ideas. Thank you, everyone. So it sounds like
Yeah.
we've got
It's
some
nice that
Carl and
something
maybe
popped
we-
up out of this.
Yeah, maybe we can,
That's always,
maybe we can
it's
get
always
a few.
exciting when that happens.
I know, it's great. Maybe we can get a few things together with
Yeah. I've
Francis
got a
Nelson,
little-
you guys.
I've got a nice
A few of
little-
us can possibly come in and sit on. Dr. Vic, Brent, you know,
Mhm.
could put together a consortium of some sort.
We are happy to contribute to anything.
Yeah.
Yeah.
Anything else that you wanted?
Nope, I think that's it.
Okay, thank you so much. Thank you
Thank
very much
you.
for being here. Greatly appreciate it. And we will be voting at the August meeting.
Okay.
So more than happy to come back and attend that. And we'll probably have some additional discussion as we get to those. I think it's further on our agenda and other business. But I think we've had the majority of the discussion. Feel free to.
Thank you so much.
Thank you very, very
Appreciate
much.
everything.
Thank you for everything you do.
August 9th, we're having a celebration in Rancho. Thank you.
Thank you. Correspondence and communications?
No, I was gonna talk about dentist being gone, but I just did. So.
Thank you. Smile Healthy reports, so I know she was talking about those just at the beginning there, but we have reports for March, April, and May, so I'd entertain a motion to put those on file.
I so move.
Moved and seconded. Any discussion? Hearing none. All those in favor? Aye.
Aye.
Anyone opposed or any abstentions? Thank you. Then next we have our invoices for the Child Dental Access Program for the months of March, April, and May at 4, 5, and 6. And just, you know, those get sent monthly to us, and the county board is copied in, Amy's copied in, Julie's copied in on those, and then we forward those on, and those are collated together. So we do see them come in monthly if anyone ever has any questions about that. So I'll entertain a motion to approve those 3 invoices unless you wanted to separate them.
So moved.
Moved by
Oh, for that.
Thank you. Moved by Dr. Vera Weiss. Is there a second?
Second.
Thank you. Moved and seconded. Any discussion? All those in favor?
Aye.
Anyone opposed? Any abstentions? Next, under CUPHD, we have the CUPHD invoices for payment of personnel and services for the months of February, March, and April, underneath H, items 1, 2, and 3. So again, I'll entertain a motion if you want to do all those together as a collective.
I so move.
Thank you. Moved by Dr. Arce. We have a
Second.
second. Moved and seconded. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? And then, underneath H also, we have our reportable duties and performance management reports. So I'll again entertain a motion just to place those on file.
So moved.
Is there a second?
Second.
Moved and seconded to place those on file. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Or any abstentions? Thank you. And thank you for your patience.
Of course.
So, update on the county sexual health education program.
Yeah, so since I last talked to you, we have wrapped up this school year, which was an eventful one, very exciting. Since I last talked to you, we were at 2 different schools in the county. One of them was the new alternative school in Rantoul, Rise Academy. So we did their 5th, 6th, 7th, and 8th graders and served about 19 students in April and May of this year. And then we also did another group of Fisher High School students in May, and we saw about 20 ninth graders. So those are the 2 places that we were at this last quarter, I guess it was.
Any questions? The one I can think of is next year. So, have not heard. Are you thinking of putting in a request for a budget?
I'm thinking about it. I know that we definitely are going to get back into Rantoul. We're definitely going to get back into Fisher. Those are the 2 county schools that we're like for sure in that have asked us back year to year. I'm hopeful Rise Academy will ask us back. I don't see why they wouldn't. And then we still really would like to try with Ludlow and Thomasboro. Those are schools that we have previously been in, but we have not been in them for the last 3 school years, just due to turnover. And Ludlow at the beginning of last school year had told us they just weren't ready to have us in. So we're hopeful that maybe this next school year we can have some additional conversations about the need and just sharing the fact that students in JW Ader and Rantoul are getting the education. All those kids from Ader, from Ludlow, different I guess too, and from Thomasboro are feeding into the same high school, so it just makes a lot of sense that they're all getting the same education. So we're hopeful for that. I just have not had time to sit down and put everything together for you guys, but I'm sure you'll see something for me at your August meeting.
I was mentioning, I know some of you arrived a little bit later, since we're talking about that, and we're probably gonna go into other business here in just a second. I had asked Mandy to kind of give us a preliminary budget and what the fund balance is, but I recognize that she's been out for some time, and probably till next Monday. So wasn't able to do that, but what I would like to do between now and the August meeting is get you some information on the budget, on the request, which I know you have the Smile Healthy request, but if a request comes in, I think 25K is, what was it last
Yeah.
year? For sexual health, that we can look at that and then also take a look at our fund balance. As you know, we've been spending down the fund balance the last 3 years. We did have quite a bit built up, which was great because an unanticipated COVID occurred, but then we got the COVID grants. And as I was saying to Dr. Reichstadt previously, is we can't always know that we're gonna have those grants when we had, the mumps outbreak, meningitis.
Yep.
When we've had, various things we've had to deal with, TB, a couple of years ago. Those come down out of the fund balance. So we only have right now the 15,000 that I can easily access, Julie can come and say, I need to isolate somebody tomorrow, and I can go ahead and spend that money, but anything beyond that requires a vote. We have to get together, it's a vote, and we vote to spend money out of the fund balance, because there's no other money in the budget that's attributed to anything else. And that's why we voted last year to keep our fund balance and maintain it at about 25 to 30% after reviewing what other communities do. And Julie got some recommendations from some other people that she'd been talking to and peers to see what we need to keep that at. So what I've asked specifically is in the budget to see what the fund balance is now too, so that when we're making decisions about refunding the additional 25,000 for the dental health program or the additional 25,000 for sexual health, that we know what our fund balance is, what percentage we're at, and what additional funds we have available to be able to continue to do that. The 50,000 for Smile Healthy is already in the budget. It has been a consistent budget item for, I think, 9 years now, maybe 10. but it has been a consistent budget item, so it's already figured into the budget. The extra 25 and then the 25 for the sexual health, that's what's been coming out of the fund balance. So I'll try to get all of that to you along with your proposal.
Okay.
So everybody has plenty of time to review it for the next week.
And
To
we
ask
can
any
check
questions.
with the schools to see if they have any money to kick in to help,
Yeah.
because they really should be helping, you know, they should be kicking into this. And as always, we will look for grants that might cover such a thing.
Yeah.
The main grant doesn't cover it because it's very specific to certain schools, and they are only in Champaign-Urbana.
What I'm hoping is, I know Travis and Mandy were going to have a conversation,
Mhm.
and what I don't know specifically is how much we had to pay back on the Carl finding. And so that will also, I mean, we kind of overestimated last year what we thought we were gonna have to pay back. And if it came in under, we'll have more money in the fund balance, and we'll be in much, much better shape than if it was over the amount we thought. So I think that's the other thing we need to know is how much of a payback was
Yeah.
attributed to the county.
Yeah, and I am pretty sure that that was padded to prepare for
We
that.
did, yeah.
Because we were hoping we wouldn't have to, but we were ready for it, so.
So, and hopefully it'll be, we'll still be over 4 or close to that, and we'll be able to continue to fund some of these other things. Anything else that you have?
There's a couple more struggles.
That's nice taking a
Thank you very much. Thank you for everything you do. Thanks for staying later tonight.
Thank you. Happy Tuesday.
Happy Tuesday to you. Update on the long-term care beds. Do you know anything?
No, I don't, I know nothing about, no, I'm kidding. Rob, well, I would assume Kathy would, be here to talk about it, but they did the presentation to the county board. We're done with our part, so they're just, working with a consultant to do a business plan and things, and that's beyond us. So the group is still going, our part's just done. So that was presented to the board and the county board, and I guess it went really well. So, got back good feedback on that.
As we're talking about budgets and county board, our presentation to the county board is August 26th at 6 o'clock. So it'll probably be myself, Julie, Dr. Peterson.
Nah, it depends on who gets it nominated.
Oh, yes,
Voted
that's
in
right.
tonight,
Slate
but it-
elections is
But it
next.
was Kathy last time.
Yeah,
was
Kathy, that's
there.
correct. Thank you so much.
I know it's been Dr. Peterson for like
I
20
know.
years, so it's kind of confusing.
Well, and isn't
That
that
is
how it's
correct.
supposed to work if you're not here, that,
You
that's,
get voted
you get
for,
voted
yeah.
to do stuff?
Oh, yeah, that's what happens.
Just look around the room.
Yeah. So that is August 26th at 6, and I've already been conversing with Travis to make sure that our meeting will still give them enough time if we make any changes to get those changes processed, and I think we're gonna be in good shape. So that does take us right to other business, a slate of officers and elections. So president and secretary treasurer and vice president.
At the risk of, just get going, can we continue the same officers?
If they're still willing to serve, I think the other two aren't here. No, you're vice president. Yeah. See, I'm still going back to Dr.
Kathy.
Yeah,
Yeah.
yes.
Kathy,
Yes. Yeah.
I guess you can, that's what happens, that's what happened at our last board meeting, somebody didn't show up and they're the chair.
So, I got an email saying that, my term will be in the end of the month. In order to be on board, I need to reapply, and with what's going on, I thought I would take a year off, maybe we'll come back next year or reapply. I did not know I had to reapply when, what's her name? Asked me to fill the position.
Oh,
What's her name?
I know who you mean, I don't know, I can't think of her name. Darlene.
Darlene,
Yes.
right. I know Darlene and her husband really well, and they asked me to.
Yeah, I think that reapplying, that, help me if I'm wrong here, but I think you pretty much just let them know that you're still interested. And that would be Steve Summers
It's
now.
pretty easy.
Yeah, it's an
Yeah,
online.
so if you
Yeah.
are still interested, you don't have to go through anything again, you just tell them you're interested or not. So, and that's Steve Summers, who took Darlene's place.
Well, I thought I'm just gonna, okay, I'll take off and then situate my,
If you wanna take off and come over here and work dental, you just let me know, we can start tomorrow.
that was the thought, because right now I'm taking care of all my patients are elderly. And I don't do pedo dentistry, and they are rough, tough crown. So I do have nitrous sedation license, but not in Illinois, it's in Texas. But I don't know, I was thinking that maybe we need to get volunteers, maybe, have days, 1 day a week for all the dentists in town. There was a lot of them since I've been here. I know Gibson City had also, in the hospital, they also had the program, the Medicaid program. Our office got phone call all the time.
Oh, yeah.
Yeah, they told us that they had appointments, and no, are you sure you didn't have appointment with the hospital? And we said, oh, yeah, the hospital.
Yeah, we could have 300 dentists working full-time in this community and be on Medicaid and uninsured, and we would still have need probably.
So in order to be volunteer to go in to do the public health, what do I have to do?
That I don't know. I would have to look into that, because that's gonna require me to get HR involved, like, I don't know. So, we've never had volunteer dentists, so I don't know how that works.
So I'm willing to serve, but I have the easiest job. Are you willing to serve?
I'm willing to serve.
Kathy's not here, so we know she's.
So we know she's willing.
So we know she's
We know she's willing.
Unless somebody else would like to do something, I move to continue the existing officers in their positions.
second.
Moved and seconded, any discussion? Hearing none, all those in favor?
Uh,
Any opposed or abstentions? Thank you guys so much. So we'll let you call Kathy and tell her she's gonna.
I will send Steve an email and let him know that he needs to start looking for another dentist for position too.
Well, and not only another dentist, but Dr. Vera Weiss just let us know recently that this will be her last meeting, and she's also leaving.
Oh.
So how many do we need?
I'm sorry, that's two.
How many dentists,
Oh.
how many positions do we need to fill?
We have two
Do we have a
positions to
county
fill,
board?
and there
We
has
have
to
a
be.
county board, right?
That was a
Yep.
question.
I'm
I
not
don't
in
think
the
we-
physician category because I'm not licensed in the state.
Right.
So
We've
mine's
got a physician category, we've always had way more physicians than are required, but that's good too. Yeah, so we'll get one dentist,
Yeah.
And then you can still join and you're not kicking the other, rejoin, and it doesn't kick the new dentist off.
Okay.
Correct.
Well,
That's
if
correct.
you can't find a dentist, I'm willing to come back. But,
Shouldn't have said that. I won't tell him that, I'll tell him to look, and then if he can't, but yes, it's perfectly fine to have more than one dentist on. I don't think any public health department has ever had that in the history of the world, but if we did, it's totally fine, just gotta have a minimum.
I'm just hoping that I am on some help. I'm still learning the road, learning all these administrative things that I am going to have to deal with.
Thank you very much, everyone, and thank you for everyone's exemplary service. Realize this is a volunteer board, and everybody gives up their time and energy, so thank you all so much. So the next two items are discussion of the upcoming budget for Promise Healthcare, and those were included in your email from Amy. And again, thank you, Amy, for everything that you do. Really greatly appreciate keeping us on track and sending out so much information to us all the time. But as I said before, the $50,000 has been in the budget for quite some time, and that is to provide care to children in our county. As Lisa was stating, 30% of the patients they see are county residents, so that $50,000 goes to providing those services. And the 25,000 is that additional recruitment, cost that we funded the last 3 years, that they're asking for again this year, so you have both those proposals.
What would the potential funding sources be if we wanted to try to carve out a administrative person to support the dental stuff we were talking about earlier? Is that, if we had a position that was dedicated to those kinds of services, would that?
Well,
How would we do that if we wanted to do that?
well, so we have a dental coordinator already for just like our program, but if we had something like that, it would be like a case management position. But really, the hard part of it is what has to happen. You have to have the infrastructure already. It's finance. It's all the finance. It's the billing, it's the coding, it's all that stuff, and the dental record, or the dental electronic health records, all that stuff. We already have that. So, it would just be another, it would just be another expense, but
That's in our budget, or could it come
It-
from the extra fund balance stuff?
well, if we had, CUPHD, if we could get something like that going, we would just do that. We would just do that. As
And
far
then-
as seeing the county kids, you might just say for this money, that has got to be used for county kids that don't have Medicaid, or 50,000 could be used for them to do the same thing that we're doing. They have the infrastructure too. It's really getting to be insane because nobody can just go and do, a qualified person just can't open up and do services. There's too many levels of crap involved. I mean, it
But we're
really
good at-
is.
we're good
It's
at
just
crap.
insane.
Well, I think
That's what we're good at.
what I hear you saying, and please tell me if I'm wrong, because I think this is how it works in my brain too, so I wanna know if I'm messing this up. If we can open up access to this group of patients where the dentists in town have the access, but not necessarily the bandwidth to do all of the backstage crap, where the backstage crap can be handled, like we can market the backstage crap handling
Yeah.
to them and make it easier for them to accept Medicaid patients, and we can say like every office, a half day, every other week or something like that. But that would open up access without spending the extra money on a new provider. But then would that burden the system here if it can even be done in a regulatory fashion?
You
Yeah,
have to
that's
split
okay.
their pay, right? So
Yeah, that's the thing that I don't know about, but as far as like setting something like that up to work with the dentist, how we did it with the vision cooperative is we had one staff person who literally went out and talked to every single eye doctor in the community and said, here's what we're doing, would you be interested in doing this? And it started out with us doing all the paperwork, but then when they found out that they could do it, that it wasn't that bad, once we got them through, kind of mentoring them through it sort of, then they just took it over. So we're not even involved, that's the ideal way.
So to do that,
So you teach them fish.
Yeah.
would we have to incur more cost to hire a person, or are you
You
saying
have-
existing staff could do it?
I would not say get another staff person right now. I would not say that. We would do it to try to get something set up like that. I think we would try to use existing staff. Now, again, this is CPHD, so we would want to do something the same way with Francis Nelson, so that we're working together so that the county gets the same thing at the same time.
Well, and the other part of it too would be is if they're doing that and there is assistance provided to Francis Nelson that then goes to the county, then that would increase the percentage of that personnel. So when we get our spreadsheet, our budget, there's a percentage of Julie's salary is attributed to us, a percentage of, all the people, Mandy. So you'll see those percentages for the work that they do for the county. So that would be the same as if that increased for that person, we might see an increase in that way of that person, or for another person is
It
hired.
might be a little bit in
A
the
little bit.
finance.
Yeah, a little bit in
That,
finance.
that's where, finance, and I don't even know. I would have to actually sit down with the dental staff and the finance staff to figure this out. Because oftentimes I say things and they're all like, I will beat you to death. I
I do
will
that too.
literally beat you to death if you try to do this. So, but to me, it is something that we can sit down. I've got a whole list of people to invite to a meeting where we can sit down and look at some kind of solution, because this community is too big and it's just too rich in terms of resources of people to be having this problem, in my opinion, and I've always been amazed by it. But it's getting harder and harder because of all the layers of Medicaid and the managed care organizations and the credentialing taking forever and the every damn thing and waiting for money. It's not a problem when we have to wait for money to come in, but for a lot of people, they're just like not doing it. And most health departments can't do it, like they can't wait for money.
I will tell you, like, as a medical director over people, like different, like NICU, PICU, outpatient peds, ped specialties, trying to get people to explain to me so that I can understand, like I'm a kindergartner, 'cause that's the level I need, how all of that stuff happens is vexing. And it's vexing, it feels like on purpose.
Oh.
Like it's hard to understand and it's complicated, and then my ask of everybody is, what am I doing at the bedside and in the medical record that I need to do different to change how things happen in the backstage so that I'm not leaving money on the table that could be used by my organization, or not being inefficient where I could do more than I'm doing. And there's never a satisfying answer. Nobody can tell me. And I think it's because there's so much mysteriousness with the process.
Yeah.
And I think that's what you're talking about, is the
It
layers.
is. It's the coding of everything. So you've got that whole level, and then you've got the coding. We've got that part down because we don't do that many services. So with dental, we've got that down. But for other things, it's just. And it is vexing is a good way to put it. It's just confusing, and it's like, why can't this be done? Bureaucracy, insane bureaucracy, you know.
Do you know whether there are any other programs that are doing it? Because some of it is probably pretty much, there's a recipe for it. And
I haven't heard of it, but I will look. It seems like anytime anything innovative gets going in Illinois, it's usually happening down here. We have to work out all the bugs, which is fine, then we give it to other people to replicate if we can do it, but I don't know of any place where I will reach out. There are not any health departments hardly at all that provide dental. I mean, there are some, but there's not a lot, and most of those are FQHC affiliates. Like, FQHCs can bill more, for it. And now they have access to the public health dentistry too, which is a good thing, that only public health departments and FQHCs get. That's where the dental hygienists can do stuff, sort of like nurse practitioners or physician assistants. They're sort of like that level, but not quite. No, not quite, but they can do stuff without the dentist like being right there. But the dentists have to agree to it, ours have, but they haven't. So they're going to start making that part of the contract, because that's like really important, and it really expands your scope of being able to use.
And just as there's electronic medical records, are there electronic dental records,
Mhm.
QU, all the things?
Yes. And that is also a huge pain. That
QU.
took forever.
I would be careful of how, supposed to cue you, that's probably more accurate. I feel like the electronic medical records, and I'm sure the dental records are the same way, they are supposed to be built in a way where it should be immediately intuitive how to not miss things and not, and document everything properly and check all the boxes.
Yeah.
In my experience, it is equally as vexing as the managed care organization.
It is
stuff.
all
Oh,
insane.
right, I mean, I've worked with electronic medical
Yeah,
records.
that's why
And
Carl
bad ones
tries to
and
give me a
some good.
hepatitis shot every time I'm in there. It's like, oh my God, I got it, get in my chart. I didn't have it here. You know, and it's that kind of thing though. That's what it does. It'll like pop up certain things over and over and over, but then you may miss the giant, you know, extra head that's growing out somebody's shoulder because that's not popping up.
Is that on TV?
And I do, yeah.
Your extra head beat the dentist.
Ew, that'd be my life.
So, be looking if we can get something from Mandy, excuse me, if we get something from Mandy, I'll ask Amy if you can send that out to everyone, because unfortunately I can't because of the Open Meetings Act, I can't send you all something, so. I know, bureaucracy later. Okay, public participation on non-agenda items, I don't see any trouble. Our next meeting is August 20th at 5 o'clock. That will be a pretty long meeting, just preparing everybody. It's always the longest meeting, is the budget meeting. So probably 2 hours, anyway, just let everybody know. Any questions or anything? If not, I'll entertain a motion to adjourn.
Thanks, Dr. Rogers.
Yes, thank
Thank
you.
you.
Thank you.
For your service.
And I've worked with health departments, but I have never been at the board meetings and all of this. And it's just so wonderful, the level of public health services that are provided here. And, you know, thank you, Julie, and thanks to all the other people who've been involved in it. And, you know, my biggest challenges in public health were dealing with bioterrorism, and I actually was hired on a bioterrorism grant in California. And then,
Well, we have a mustard gas tabletop coming up on Friday, I think, so if you're interested.
so then what?
Mustard gas tabletop.
Okay.
Am I supposed to know what maybe I'm not supposed to.
Spoiler alert.
Spoiler alert, mustard gas.
But I did learn to work with veterinarians because they were part of bioterrorism.
Oh, yeah.
Experts because of some of the illnesses that were being used as bioterrorist agents. So, you know, so that having a veterinarian here, in addition to it being an agricultural community, it was good. Dr. Green to join us. And so thank you all.
Thank you very much. It's been an absolute pleasure, and thank you for all of your insightful critique and feedback and everything you provided over the last several years. It really has made a difference, particularly in the pandemic, and we talk about, you know, one crisis situation after another, so thank you very much.
Are you guys just getting off because bird flu is stirring up out there? Is that why you're getting off of here?
Because of what?
Bird flu,
It's not
H5N1.
flying away from bird flu.
No,
All
I was
right.
wondering whether you might hear
Um,
something about it.
You made a motion. Did someone second?
Yeah.
Okay, thank you, just I forgot. Okay, moved and seconded, all those in favor?
Aye.
No opposed, no abstentions. Thank you very much.
Bird
Thank
flu
you.
getting an old man.